Welcome to Managing MDS. My name is Moreno Festuccia and I am a hematologist from the University of Torino in Italy. I had the pleasure to work with the colleagues of Fred Hutchinson Cancer Research Center of Seattle in the MDS MPN team during the last 10 months. We are frequently asked, why is it important to send a patient in consultation for a second opinion before starting any active drug? Well, as you know, myelodysplastic syndromes are one of the most common hematological disorders. The only cure for this disease is so far the allogeneic transplantation. There are few drugs FDA approved for MDS treatment, as well as the hypomethylating agent azacitidine and decitabine, the immunomodulator lenalidomide, and the immunosuppressive treatment, primarily based on anti-thymocyte globulin ATG, and the growth factors. However, excluding transplant survivor, even considering treatments with drugs that have demonstrated to increase the overall survival in phase 3 trials, our patients are still losing the majority of their life expectancy. Moreover, the transfusion need and the treatments can heavily impact on the patient quality of life. That's the reason why, in my opinion, it's really important to give to patients the possibility to participate in clinical trials. This is the only way that we have to understand something more about the disease in order to improve outcomes and quality of life. The best design for a clinical trial requires the randomization among different treatment arms. Some trials open to enrollment in our institution or in other research center are, for instance, comparing the efficacy of new molecules in association with FDA-approved compounds. The previous treatment with hypomethylating agents or lenalidomide, for instance, can be an exclusion criteria for these trials. Even if we consider MDS patients that are candidate to transplant, a previous treatment with active drugs, growth factors excluded, can be an exclusion criteria from per-transplant bridge treatment clinical trials. We would lose, in this case, important information at the basis of future improvement in MDS patient care. So if you are planning to send a patient in consultation for a second opinion in a research center, please discuss the possibility of the participation in clinical trials. If the patient seems to be interested in that, remember to send him for consultation before starting any active drug. Doing that, you will be sure that your patient can really consider all the available options, and you will allow the scientific community to learn more on pathogenesis and treatments of MDS. This is also essential to ensure informed patient-shared decision-making. Thank you for viewing this activity. For additional resources, please view the other educational activities on managingmds.com. Thank you.